Hi guys. So my name is Tisha and I'm pretty much here just to talk to you about medical assisting and also the route. Maybe some of you all are thinking about starting a career medical assistant, but you just don't know which route to take as far as which school to go to in your area and what would best benefit you as far as what you get out of your education. I'm just here to tell you that it could be confusing. It could be a challenge as far as getting your foot in the door and just starting out, period. Um, for me, I would say that the most important part about becoming a medical assistant is what I would be able to get out of it initially is the education part. I thought that I would have to go to a 2 year community college or something like that in order to get into the door, or be able to build a resume, and that would look best on my resume as just being in a 2 year college. But that wasn't the case for me. I'm glad that I did my research on it because it just so happened that one of the local tech schools here offering medical assistant worked out best for me. When you do look for schools and when you do look for schools and just start out the process of trying to get in the door, and start out, I would say do your research on the schools that are accredited if you don't want to do the 2 year route, because you just don't have to. The school that I went to and graduated from was a school here in the state where I am living, and it was a 6 month program, and pretty much it was everything that a 2 year college or tech school would offer, but it was just condensed down into 6 months. Um, at the 6 months, we every month would be a module, so it would be 4 weeks, and that would be touch on different areas in medical assistant, whether it be clinical, or phlebotomy, or whether it be lab, or whether it be HIPAA and things like that, or medical coding and billing. And we did all of that in 6 months. What I've noticed is a lot of the schools, or a lot of maybe in-state schools, tech schools, they do offer you the education, but some of them make you pay for your certifications. That is the main part. When you go for medical assistant, you want to make sure that you're able to get your certifications. That's what the jobs are looking for. They're looking that you have the book time, the class time, lab experience, but they also want to know that you're able to get your certifications, that you're passing your certifications. That's the most important. Even if you go to a 2 year school, they still want to know that you're a certified whatever, whether it be a phlebotomist, a medical assistant. They want to know that you're certified, that you can actually do the work. Um, What my school, they offer externship, and it was 320 hours, so it was 4 weeks of externship at one of your local physician's offices or something like that. There's somewhere where you can get hands-on experience. My school did offer the 4 certifications for free. I would say when you're looking for a school, whether it be community college or whether it be the route I took, and that was a local tech school that offered medical assisting, you want to make sure that it is accredited. What I mean by that is everywhere that you go, as far as getting your foot in the door and starting your education with whatever school, you want to make sure that you have the basics, and that is that you're taught phlebotomy, you're actually doing the work as far as sticking your classmates, and you're getting your sticks in, and you're able to actually have hands-on experience in class and have your labs. That's most important. You also want to look into the certifications, what they offer. If they offer your certifications for free, that's A1. That's what you want. I've noticed that some people have to pay a fee, whether it be $100 or something, to take their certifications through the state board. That's fine too, but it just So happened that my school combined everything and they offered the certifications for free. Um, but after you graduate from school, it's on you. So you pretty much, if you taking that module as far as phlebotomy, you taking that module 5 months ago, you don't remember what's on the test, you have to study yourself. You have to bring strong will and study and pass your certification, because that part is on you. You're not going to have an instructor there to help you. You know, they're not going to be able to tell you or go over any kind of details about the exam. That's on you. So, just getting back to the schooling and trying to figure out what school would best work for you, I would say just go for the school that can offer you the minimum as far as the education for medical assistant. The number one is medical terminology. And number two would be that they offer you phlebotomy experience as far as your sticks. I believe some people, some jobs require you to have like 100 sticks before you're able to stick someone in the real life working experience on the job. They don't want to do on the job training with phlebotomy. They want to know that you are up to date with OSHA regulations, HIPAA regulations, and standard precaution. Um, so those would be the minimum things that you need to look for as far as schooling and what would best fit for getting into school, getting out of the school, being certified, and for your credentials to be held up as far as in the workplace. Um, I would say don't get so held up on the type of school. Um, like I said, if it's a 2-year college, that's great, fine and dandy. But if one person is going for 6 months and you're still in there after the 6 months and you still have a year and a half to go and that person has a job, don't be mad at anyone except for yourself. Because, like I said, you just want to make sure that that school that you go to is accredited and that you get the minimum out of it. And that would be the phlebotomy, hands-on, the precautions, HIPAA information, and also lab work, and also medical terminology is number one, because all test schools have to teach medical terminologies, and most jobs want to know that you have medical terminology experience. Another thing, since I've been out of school and starting the interview process, a lot of jobs want to know what systems you're familiar with as far as your electronic health records. They want to know if you have experience with checking patients in, checking patients out, insurance, patient insurance. They want to know if you have that knowledge about insurance. That's number one. That's what I've been hearing a lot. And also what systems your employer work with. Mine was Epic system, EHR. So, and then again, with another important factor would be where you go for your externship. I know a lot of people are nervous when they get out of school because that's like the end of your class career. You're leaving your classmates and you're starting your career. Externship, I look at it as being a positive. For me, I got a lot out of it. The extern site that I went to was an OBGYN, and pretty much they had every department within them. So I was able to touch on a lot of the things that I did in school. They had check-in, they had check-out department. So they had the front office and they had the back office, and I rotated 2 weeks between each one of them. They also had a lab, and we worked with venipunctures. I've stuck patients after sitting with the senior rep. I've stuck patients on my own. You need to pay attention and in class in your lab, because real life happens when you're in extern, depending on what site you go to. So I would just say choose wisely. If your instructor asks you, what site you would like to go to, make sure that you do your research and you put yourself in a site where you could get hands-on experience. The site that I chose, like I said, had many different departments. I could learn customer service within the medical office, which I did. I checked inpatients, I checked outpatients, I used their EHR system. I ran insurance, did insurance checks, checked patients out, let them know their balance. Also, information about their insurance and what their insurance covered, what their insurance didn't cover. In another department, like I said, we did lab, and that was we touched on a lot about vitals. I'm sorry, it's my phone. We touched on a lot about vitals and the height, the weight, and while you're doing this real life scenario things, the patients, they actually do have questions, so you want to know and be able to answer patient questions, whether it be, what is the normal resting rate for blood pressure, what should my hemoglobin be, is it too high, is it too low. In my external site, I did CBCs. I ran CBCs after doing venipuncture sticks. I collected urine from patients and performed urinalysis, cultures. You just want to make sure that your school is teaching you everything that you need to know, because there's a lot of things that you need to know, and there's a lot of different directions that you can take with having the medical assistant certification. It's not just working with the doctor and speaking with patients and checking them in and vitals. There's a lot to go along with it. The doctor may have you draw blood, do culture, and do temperature. You just need to at all at one time. So it's just things that you need to know, and you need to be able to give patient education as well. So that's just a short video, just letting you know about the school and about the route to kind of take when you're looking for a school. Make sure it's accredited, and make sure that even if you have to contact the physician's office to find out what they do a day in the life of a medical assistant, what do you normally do, even if you have to ask questions like that, you just want to make sure that when you choose your external site, that you're getting the hands-on experience. You don't want to go to a dermatologist's office or something like that. You want to go somewhere that you're going to actually work, even though you're not getting paid for it. It's a part of schooling, and you just have to look at it as being a learning experience, hands-on learning experience. So that's about it for this video. Again, don't worry so much about the type of school it is, whether it be 2 years, 6 months, 8 months, 1 year. The most important thing would be to get a school that is accredited and that will offer medical terminology, phlebotomy, hands-on experience, as far as sticking your classmates. Yeah, I would say that is it. Thank you so much for watching this video. I'll also make a video on certifications and how to pass the phlebotomy and certified clinical medical assistant test exam, the state test. I will do that video. Like I said, I have been certified in both phlebotomy and certified clinical medical assistant, so I'll let you know what to expect when taking those tests. Thanks for tuning in.